Hello, my name is Nikhil, and we are OtoAI, and we are developing a digital otoscope that uses a novel machine learning algorithm and photo information to improve upon the traditional ear exam for patients and physicians. So, otoscopes are what doctors use to conduct ear exams during a routine checkup. So, the primary problem that we're trying to address is that physicians are basically tossing a coin when trying to predict whether a patient has an ear infection or not, and are really only accurate about 50% of the time. Some of the factors that have led to this low percentage are that otoscopes currently don't have any mechanism for actually capturing images, and PCPs are not trained to recognize ear pathologies. COVID-19 also places an emphasis on minimizing patient contact, as traditionally the physician would be right up against the patient's face when conducting the exam. This is an important problem to solve due to the high number of ear infections that occur in children, causing stress and confusion for the kids, but also for their parents. In order to combat this, doctors just prescribe blanket antibiotics, which adds to the problem of antibiotic resistance. And now Yash is going to talk about what our solution, OtoAI, entails.
Thanks, Nikhil. Currently, there are no other FDA-approved otoscopes on the market that meet the challenges outlined previously. Rather than a simple instrument, the utopia would be a next-generation otoscope that utilizes modern-day technological advances to capture images and assist PCPs with making real-time diagnoses of ear pathology. Enter OtoAI. Our product outperforms current market otoscopes in three key areas. First, we provide better technology, enabling image capture and software enhancement to improve the quality and lighting of the image. Second, we provide accurate diagnoses using deep learning techniques to enable us to detect ear infections with a 90% classification accuracy. While ear infections are the most prevalent form of ear pathology, our model is also able to detect broader abnormalities in the ear with a similar accuracy. And finally, our product is telemedicine friendly, allowing seamless data storage, transfer, and integration with the hospital EMR system. Our product was designed to mimic the form factor of traditional otoscopes, ensuring a comfortable and familiar experience for physicians. At the click of a button, our otoscope will capture an image of the ear and display it on our user interface. Once the physician has selected the desired image, our trained deep learning algorithm classifies the pathology as normal or abnormal and generates a report that can be directly uploaded to the hospital EMR system. Jonathan will now talk about the hardware and software design process.
Thank you, Yash. Last semester, with our minimum viable product, we proved that we can use an ear cleaning endoscope to capture medical quality images of the inner ear. Then, using a CNN or convolutional neural network, we were able to classify our pictures of the inner ear with an accuracy greater than 60%. Since then, our product has made significant progress. We changed our model to a transfer learning CNN, which uses information from a more robust, previously trained network to pick features, and this led to a more than 25% increase in our model's accuracy, which we rigorously tested. We then designed and created an easy-to-use encasing and fully integrated our device with a clean desktop application. We have created a fully functioning digital otoscope. We found that images could be captured using a low-cost ear cleaning endoscope. We were then able to enhance those images to allow for better visibility of the tympanic membrane and the ossicles behind it, which are important landmarks in diagnosing ear pathology. We then fitted the endoscope with familiar encasing, which we designed and iterated on with the help from our clinical partner, Dr. Stephen Lightus. We also added an adjustment screw to allow the physician to adjust their entry angle, which is important for different size and shaped ears. Attached to the head of our device, you can see a plastic speculum in black. This is a disposable part, which is readily available and FDA approved. After more testing, we added a soft touch button, which makes it easy for doctors to begin to use the device with just one hand. The OtoAI software is based on a 2,000 plus inner ear dataset gathered from patients by ear pathology labs across the country. Our first step was to augment this dataset by randomly rotating and changing the exposure on images to synthesize a 9,000 plus inner ear dataset. We then created a transfer learning based convolutional neural network and iterated on parameters while consulting with PICS professor Paris Perdicaris. When we were satisfied with our algorithm, we began to test based on our own ears and many images of ears off the internet. We generated heat maps of where the algorithm attributed the majority of its decision making on the image and confirmed both the heat maps and the final decision with our clinical partner, Dr. Stephen Lightis. We then developed and iterated on a fully integrated interface, which allows users to view live video feed of the inner ear, capture multiple images, and choose the ones that they want to classify into a report. We will now show a brief demo video of how our device works.
We're going to be conducting the ear examination with the Otoscope. The first step is to just launch the application and enter in the patient information. From there, a window will pop up that allows you to choose the folder that you want to have your image stored in. And then from there, you can take your Otoscope and insert it into the patient's ear. You can click the button whenever you're ready for your image to be taken, which I just did, and then you can choose the image to generate the report. Once you generate the report, a PDF will pop up, and that has the classification diagnosis.
We evaluated a classifier against a set of 2,000 otoscopic images that were scraped from publicly available databases. We allocated 70% of the images for training the classifier and 30% of the images for evaluating the performance of our classifier. We were excited to see that the OtoAI classifier was 90.32% accurate in identifying abnormal ear pathologies that require further checkup with an ENT. Currently, PCPs are only able to correctly diagnose abnormal ear pathologies 50% of the time using otoscopes. And so this is a substantial improvement. Now, more than ever, is a perfect time to bring OtoAI to the market. Given the pandemic, there has especially been a need to reduce doctor visits, but even post-pandemic, a reduction in doctor visits can maximize patient interactions and allow physicians to optimize their time as well. Furthermore, physicians and hospitals are also more willing to engage in telemedicine and digital health, and so OtoAI can really capitalize on this transition. In general, this device is intended for primary care physicians who do not have the proper training to effectively use an otoscope and make accurate diagnoses. Within PCPs, there are two subdivisions: PCPs at large public hospitals and PCPs in private practice. The PCPs at large public hospitals will be easier to reach as we can capture large groups more effectively. The private practice PCPs will be a little more difficult as this will require individual pitches. And so moving forward, we will definitely be focusing first on PCPs at large hospitals. And now Uday is going to take it away and talk about the market size.
Thank you, Krishna. As we move on to the market size, we can see that the traditional otoscope market size in the United States is approximately $100 million as of 2021. Furthermore, there's 6,090 hospitals in the US and 209,000 primary care physicians, of which 49% are private practice. As we move into the business model, I'd like to acknowledge that OtoAI leverages the Tesla model to create two sources of revenue. First, we have the upfront hardware, which is the device that you saw earlier in our presentation. We price this at a cost of $80 per otoscope, which is very comparable and actually a lot better than the current otoscope, which costs $200. This costs us $56 to produce, giving us a profit margin of approximately 43%. On the software side, we have an additional source of revenue through our software subscription service, which is actually our classifier and the accompanying features that come with it. We price that at $5 per month. As we look to the future, there's 4 major steps that we need to take between now and product launch. First, we need to conduct a clinical trial at HUP. Second, we need to seek FDA approval, which will take approximately 3 to 6 months once we have our results. Third, we need to advance our software and try to identify specific ear pathologies beyond the normal abnormal nature of our current classifier. And finally, we want to partner with hospitals to get our device into the hands of as many primary care physicians in the near future. Before we conclude our presentation, I'd like to acknowledge Dr. Stephen Lightis, who is our primary clinical mentor at HUP. I'd also like to acknowledge Dr. Paris Perdicaris, who helped us with our classifier. Dr. Meany, Dr. DePaulo, Seville, and Melanie, our TA, were instrumental in the development of OtoAI. With that, I'd like to conclude our presentation. We are OtoAI. This is our contact information if you have any questions. Thank you.